Take a moment for your body. Take a moment for your mind. For your spirit. Take a moment to be loved. Take a moment to be healthy. Take a moment to pray. Take a moment for worship. Take a moment every day. Take a moment for your body. Take a moment for your mind. Take a moment for your spirit. Take a moment to be loved. Take a moment to be happy. Take a moment when you pray. Take a moment for worship. Take a moment to show you care. Take a moment to show you care. Just to show how much you care. Yeah.
Good evening, everyone, and welcome again to another healing moment. We thank you so much for joining us. We know that you would have had so many choices of things to do, but you chose to be here. So we know that you will not be disappointed. This month, our focus is on the theme trauma. And before we begin, as usual, we will have our prayer, and then Brother Trevor will lead us in the spiritual aspect for this evening's program.
Thank you so much, Sister Sherry. Let us pray. Heavenly Father, we are thankful that you have led us to be part of this program, both as participants and listeners. We ask, dear Lord, that what goes on here this evening would be a means of drawing us closer to you. May a means of helping us in the various situations in which we find ourselves to find healing. So, Heavenly Father, we can send the praise up to you, and the blessings would indeed come down. So put your words in our mouth this evening, those of us who have to speak, so that what we say bring honor and glory to you. This is our prayer for Christ's sake. Amen. Sister Soares, 2 weeks ago, when she dealt with this topic of trauma, highlighted to us that trauma can come to us in varying ways. And we know that trauma is a byproduct of sin. It wasn't at the beginning. It is a byproduct of sin. And so Jesus Christ, when he came to this world as a human, wasn't exempt from trauma. So I'm going to highlight 3 instances in his life. There were more than 3, and I'm sure you will be able to recount some as I go through. 3 instances in his life which followed each other, which were very traumatic. The first one I'm looking at is in the Garden of Gethsemane. Jesus is there. He's asked his disciples to pray with him, but they're asleep. 3 times he goes back to them and they are asleep. As the weight of the world of sins is on his shoulders, he's in anguish. He's asking his Father for a possible way out of this, in which to save mankind. God tells him there's no other way. Christ then, under this trauma, submits to the Father by saying, "Not my will, but thy will be done." God immediately sends angels to refresh his son, to give him the impetus to go forward again. So as Jesus leaves the Garden of Gethsemane, he's determined to go forward to carry out his Father's will. He will go all the way to Calvary. That's traumatic situation 1. The next traumatic situation follows immediately after this. He's on the road to Golgotha. He's been beaten mercilessly by demon-possessed soldiers with a cat-o'-nine tail. Each time he's lashed, the metal on the end of the straps go into his skin and pull flesh out. His bones are exposed because the flesh is ripped away. He's emaciated. He's bleeding. He's bloody. There is no record of him on this road to Calvary asking his father for help. But the father sends Simon of Cyrene, a black man, to take that cross all the way to Calvary. Simon was not there by accident or incident. He was there by the design of God. He didn't ask the father for help, but the father sent Simon. The third traumatic situation, we find Christ on the cross. He's thirsty, he's weak, he's in pain, but yet still he finds times to promise a thief to be with him in paradise when he comes the second time. He even finds time to look after his mother. Then, as the thought of eternal separation from his father sets in his anguish, in his humanity, he cries out, my God, why hast thou forsaken me? You see, your sins, my sins, our sins separated the Father from the Son. Yet still Paul could write, God was in Christ, reconciling the world unto himself. Jesus feels this separation. Having said, my God, having asked the question, my God, why hast thou forsaken me? That is trauma. Christ then says, Father, into thine hands I commend my spirit. He cries out to the Father during his traumatic situation. This time, the Father's response seems somewhat delayed. 2 days later, the Father sends an angel to the burial place where Jesus Christ is in the tomb. The angel gives a message to Christ and said, your Father has called you. Jesus Christ raised himself from the dead. Christ found himself in traumatic situations. The Father never deserted him. The Father sent aid to Christ when he was in his trauma. This evening, I'm saying to you, I'm saying to me, whatever traumatic situations we are facing, the same way that God led his son, the same way that God reacted to his son, he's going to react quite similarly to you and me. The Bible says, I am the Lord and I change not. In fact, God loved us even more than his son, because God was willing to risk separation from his son eternally in order to save you and me. My point, God will come through. God is there for us. So whatever traumatic situation you are facing right now, remember how God dealt with his son, and God will deal with you and I similarly. So we can be at peace even when we are in traumatic situations. Thank you.
Good evening, everybody. And for those of you who are now joining us, welcome to this evening session of Healing Moments. At this time, we'd like to thank Brother Blenheim for this introduction in the devotion to trauma. And at this time, we would like to invite Sister Sherry Sobers to speak on the topic of trauma and PTSD.
Thank you again, Lori, and good evening again, everyone. Now, 2 weeks ago, when we started the topic of trauma, I would have given you a definition. I would have told you what trauma is. And I'm just going to start by reviewing that definition and what a traumatic event is. Traumatic events involve either actual or possible death or serious bodily injury, or they can be related to sexual or physical violence. We would have said that at least most adults, at least once in their lives, would have experienced a traumatic event. And for the majority, we have experienced more than one traumatic event in our lives. Trauma can be chronic, meaning that similar events happening over and over again over a long period of time, or they can be a one-off situation. For example, you get in a car accident, and that in itself is traumatic. It raises the blood pressure, it causes you to get a headache. Some persons may have other physical bodily reactions to it. And so there are a varying amount of traumatic events that we can speak about. For example, we spoke about sexual and physical violence or abuse or assault that can happen. That in itself is very traumatic. We spoke about vehicular accidents, which can result in bodily harm, or even if they do not result in bodily harm, just the trauma alone of knowing that you may have endangered the life of yourself or someone else can be in itself traumatic. For those soldiers who have been in combat or in a war zone, or persons who may have been in a war zone, and I'll speak about this later, they also experience post-traumatic stress disorder, which is on the other end of trauma. We can think of serious medical situations. What we are going through now in this pandemic, there are so many repercussions that are traumatic in every person's life. I believe everyone on the planet has been touched by COVID-19. For those persons who see death often, who work in hospitals, who work in mortuaries, who for them, this is part of their life work. At some point in time, you suffer trauma. If you've had an unexpected death of a loved one, that is traumatic. You go to work, you're fine, the person leaves home for work, and then during your work day, you get this call. Initially, you go through denial, it can't have happened. Oh, this is a joke. But then when you actually see what has happened, it is traumatic. For those who have gone through natural disasters, and I believe everyone listening here to this evening has experienced at least one natural disaster or even more. Simple things like after the disaster, hearing the rain. No, I'm not talking about the rain during, for example, a hurricane, but just hearing simple rain, hearing the wind, hearing thunder, seeing lightning. Those things can be triggers to what happened during your traumatic event. Another one can be arson or house fires. Another trigger for that could be the smell of smoke. And imagine losing everything in a house fire. That is in itself grief and loss. You lose memory, well, not memories, but you lose things that when you look at pictures, you lose family heirlooms. Those things are traumatic. Victims of torture can tell you that they experience trauma to the point where some of them, if it is not dealt with properly, have serious issues with interpersonal and personal relationships and being physical with the members of the opposite sex. Similarly, women who are victims of domestic violence. If you've witnessed or if you have experienced violence, that can be traumatic. And everyone knows that the United States post 9/11 was a different place than prior to 9/11, when they endured that mass terrorist attack. So all of those are examples, and there are many others that I may not have spoken about, are examples of traumatic events. And as I said before, in life, we may have experienced at least one. I pray that you have not experienced more than one, or that it is not reoccurring. But if you have, and it has not been dealt with, then that is something else that we need to focus on and think about. And therefore, our responses are different. Number one, to the different traumatic event, and number two, based on who we are as an individual. Professionals have found that there are basically 3 different paths which adults can follow when they're dealing with trauma. The thing is that you never know how you will manage until you are, unfortunately, in the circumstance, in the experience. And there are some things that are precursors that can help you to identify how you will or will not respond. For example, if you have a strong family structure, if you have a strong family support, that can help buoy you up as you go through your traumatic event. If, on the other hand, you have a history of depression or alcoholism or drug abuse, or you may have a personality disorder or something with your personality, those things, the traumatic event can trigger these things to come on again. So let's talk about the individual responses. And there, as I said before, there are three basic responses. The first one is that some people never experience any major problems. This is known as resistance. It is common after traumas like that do not involve sexual assault, like maybe a car accident, and especially if the traumatic event only happened once. There's something in our situation, whether it be a strong family background, strong family support, or personality is such that we are able to resist this event. Then the second one, some people may have symptoms that are similar to post-traumatic stress disorder, because as we said before, we all experience traumatic events. And these may last for a few days to maybe a few weeks after the trauma. That is normal. For most people, they will then go away naturally. And if you have the need for professional or mental health help and you get that and you're able to work through the issue, they go away after a few weeks or a few months. This is known as natural recovery. Your body initially reacting and then you being guided along the process to recovery or resilience. However, there are other people, for them, their symptoms do not go away. And they actually become as if they were literally stuck. That's what we're going to speak about later as we speak about post-traumatic stress disorder. Trauma symptoms usually or typically last from a few days to a few months, depending on the traumatic event and depending on the consistency of that event. And they fade away after you would have had the unsettling event. But even if you're feeling better, sometimes you have a trigger and that may send you back. But soon enough, because of your resilience, you are able to bounce back. That is normal. But if your psychological problems don't ease up, even if they become worse, and you find you are unable to move on, you find yourself just stuck for a prolonged period of time, chances are you may be experiencing post-traumatic stress disorder. So what does that look like? It is a mental health condition that may be diagnosed firstly by a professional when someone has experienced a trauma and not just experience it, but they have experienced symptoms that suggest that they are stuck. And I can use that word because we can think of the imagery of just being stuck. The symptoms may be re-experiencing the trauma, having flashbacks that are unsettling and disruptive, and having intense physical or emotional reactions to reminders of the events, having nightmares where you wake up or where you're screaming and you just are out of it emotionally. Some persons may experience avoidance symptoms. For example, they don't want to hear anything about the event. They don't want to discuss anything. They don't want to go where it happened. If it were a situation where there's a separate place, they avoid people, they avoid places, they avoid activities, they avoid sensations that may even remind them of the event. Others may experience negative changes in their thinking, their thoughts. Thought patterns change. Feeling, if you have that leniency towards depression, You start to go through the depression symptoms. You find it hard or impossible to be happy. You feel shame, you feel guilty, you feel distant from others, or you literally withdraw, you lose interest in the things that you normally found interest in. You are unable to remember important parts of the event, like if you literally shut it out of your brain. And you just have these negative thoughts, your self-image is crushed, and you just go through this negative experience. And then for others, they are hyper aroused or emotionally or physically reactive to everything around them. So they are super on their guard all the time, easily startled. It's as if they are walking, or you are walking on eggshells if you are around them. They have trouble concentrating. They're quick to get angry, quick to be aggressive. They may do things that are risky and impulsive, that are out or not in their nature. Or they may be having trouble sleeping, which is the opposite to re-experiencing the symptoms. So as I close, the most effective therapeutic approach to long-term severe PTSD can be talk therapy. You can discuss, and if you work with a clinical psychologist, for example, part of your steps in therapy may be for you to go into a lot of detail with the event. It helps to be able to go through the steps, what happened and stuff like that. Or it may involve behavior or cognitive therapeutic approaches as well. And as I end, I always end with a quote. And this quote, the quote this evening is from Alex Lifespan. And he says, the shock of any therapy, of any trauma, I think, changes your life. It's more acute in the beginning, and after a little time, you settle back to what you were. However, it leaves an indelible mark on your psyche. Remember that as you go through your traumatic events, or as you try to go through them, remember yes, they change, but they leave an indelible mark on your psyche. Thank you so much for listening, and I look forward to your discussion later down in the program. Thank you.
Take a moment for your body. Take a moment for your mind. Take a moment for your spirit. Take a moment to be loved. Take a moment to be healthy. Take a moment when you pray. Take a moment for worship. Take a moment every day. Take a moment for your body. Take a moment for your mind. Take a moment for your spirit. Take a moment to be loved. Take a moment to be happy. Take a moment when you pray. Take a moment for worship. Take a moment to show you care. Take a moment to show you care. Just to show how much you care. Yeah.
Welcome back. For those of you who are joining us on Zoom, on YouTube, we'd like to welcome you to this month's topic, Healing Moments Trauma. I'd like to introduce to you my co-host, Azriel. And at this time, we will be speaking to Dr. Corinthia Dupuy. He's going to speak on the medical side of trauma. Dr. Dupuy, good evening and welcome.
Good evening, Lurian, and thank you, everybody, for joining us. I am going to share my screen, Ken. Okay, thank you. Welcome back, everybody. It's wonderful to be here. I'm going to talk to you about something that I spoke about the last time, because I didn't have any pictures, and I hate not to have something that will allow people to have an image of what I'm talking about, because as a pathologist, I have to be very visual. We learn to recognize patterns. We learn what is normal and we learn what is abnormal. So we're always showing pictures. And so I just want to take you back to review some of the things that cause trauma in the body. And then I want to show you a few visuals of what they would actually look like in the body when it comes to a disease process. So we talked about the types of cell injury. So a lot of this is going to be revision. So there are physical agents such as mechanical traumas. Somebody hung in your hand with a hammer. You getting crushed, mechanic getting crushed on their truck, somebody getting hit with a rock on his head. Then we have temperature changes. So we have heat injury, or you may go up to the top of Mount Everest and you may go diving. And so because there is so much pressure down there, if your equipment fails, you may get injury from the high atmospheric pressure or from the change in pressure coming up quickly from the bottom of the sea to the top. Radiation can also cause injury. And we're not talking about cell phone radiation. We're talking about radiation from the sun. We're talking about ultraviolet radiation, or we're talking about radiation from a bomb blast, for example, or radiation from materials that may be in your home, from building materials that you may not be aware of that may have radiation in them. X-rays also cause radiation injuries. So even though we need X-rays to diagnose diseases, if there is overexposure to X-rays, that can cause injury. And things like electric shock are also examples of physical injury that can cause cells to be damaged. Then we have chemical injury. So even substances inside the body, like glucose, which your body requires for normal functioning, if there's too much glucose or too little glucose circulating in the blood, that can cause injury to the cells. We have electrolytes that are always circulating in our blood. We have sodium, we have potassium. Normally when you do a blood test, the doctor draws blood, sends to the lab, and you get the level of potassium and sodium. If those are deranged, they can also cause injury. And the regular poisons like cyanide, gramoxone, any other weedicide or insecticide can cause injury. We like to spray. We don't like vermin around our house, so we may see one cockroach and we want to spray the entire room. That is injurious. That is not a good, healthy habit to pick up. And we mentioned last week environmental pollutants, the sulfur pollutants, pollutants from planes, trains, automobiles, industrial hazards like asbestos, which used to be used in ceilings once upon a time, but is now known to cause lung injury. and medications. Overdose of medications or even normal doses of medications may end up being toxic to an individual. And then there is oxygen injury. Too much oxygen can cause injury in infants' lungs, especially premature babies. They can get injury. They can actually become blind from getting too much oxygen. If the body is deprived of oxygen, either by a blood vessel being blocked or by the oxygen in the air being depleted. So if one is locked in a room and there is no air coming in, no air circulating, eventually you'll be rebreathing carbon dioxide. And that can injure not just your lungs, but your brain and your entire body. Then we have infections, the regular ones that we know about, measles, mumps, COVID-19, gonorrhea, syphilis, parasites like worms and other such parasites, ticks, etc., other biological agents, allergic reactions, we mentioned those. And then there are genetic abnormalities, inherited diseases such as sickle cell disease, hereditary neurofibromatosis. All of those are common genetic abnormalities that we see in our population. And we mentioned as well nutritional deficiencies. Many of us are deficient of vitamin D in particular, which is surprising because we live on a tropical island where there is a lot of sunshine. But we like to walk around with long sleeves and suits and ties up to our necks and scarves and all these things. And we have to end up supplementing vitamin D, which is really a shame. We should really be walking around in the sun for a bit, at least get some early morning sun, walk for an hour, let your legs get some sun, let your arms get some sun, neck and face. We should not have nutritional deficiencies, but that's not, that the lecture is not on vitamin D, the lecture is on cellular trauma. So nutritional deficiencies and nutritional excesses can cause injury to the cells. What are the outcomes? This is very comparable to, this is very comparable to what Sister Sherry was saying when she talked about psychological injury, in that if the injury is mild, if the trauma is mild, one may be able to resist it, one may be able to withstand it, it may be reversible. However, if the trauma is intense or the trauma is persistent, it can eventually lead to more widespread injury, cell death, tissue death, for example. I want to remind you of the diagram of the cell. This, as complex as it seems, is actually a simplification of what goes on in the cell. But if you look at every aspect of the cell, for example, the mitochondria, where the energy is produced for the cell, if the mitochondria are damaged by the poisons, then the cells can't produce any energy. So there's going to be no uptake of nutrition, etc. If the plasma membrane is affected by the injury, then you're going to have water flowing into the cell, calcium flowing into the cell is going to burst. If the cell bursts, it's dead. If the injury damages the nucleus, for example, if we have radiation injury that damages the nucleus, we can have chromosomes going wild, chromosomes behaving as they shouldn't, the cell dividing willy-nilly, out of control, and a cancer develops. Okay, so all of these are the Golgi, for example, where the proteins are packaged. If that is damaged, then you have abnormal proteins being produced or too many proteins being produced in the cell membrane gets clogged up, coagulated. Again, the cell dies. Yes, that's it. Right, so adaptation to cellular injury. Sometimes the cell doesn't die, but what can happen is that based on the type of injury that occurs, the cells can increase in number, because if the cells increase in number, then they're better able to carry out their function, seeing that some of them are being you're getting pressure on them all the time and say, you know what, let's just multiply so we can do this job more effectively. So we have hyperplasia, increasing the number of cells. Sometimes the number of cells has increased, but the size of the cell increased. So somebody's lifting weights all the time. That's traumatic to the cell. Eventually, the person will get the nice muscles, but if the cell doesn't increase in size, the stress of the bodybuilding can actually destroy those cells and tear those muscle fibers up. So you have hypertrophy, that's what it is. And atrophy, I know I mentioned those words, but I didn't have them there. And the teacher in me says that I should let you see what I'm talking about. So atrophy is decrease in the size of the cell, eventually decrease in the size of the organ itself. And so, yes, so the organ decreases in size. So I mentioned last week, you have a stroke on the right side affecting the left side of the body. The arm and leg on that side of the body become smaller. They don't need as much nutrition as the cells that are normally functioning. And sometimes the cell may actually change in shape so that it can better function in the type of environment that it is being exposed to. And sorry for the blurring of this photo, but it just shows you what hypertrophy is. The cell increases in size. Hyperplasia, the number of cells increases. And this is an example of metaplasia. You have the normal cells. Well, they're both normal cells, but the normal cell that would be in that kind of tissue would look like those on the left. And because of a particular type of injury, they may develop cilia. They may increase in length, develop cilia at the top so that they can better function in the context of a persistent type of trauma. And I have these diagrams of the heart side by side to show you what hypertrophy is, an example of what hypertrophy is. So this is a normal heart on the left, right? The diagrams that you learned in school, right atrium, right ventricle, left atrium, left ventricle. In the face of hypertension, when the heart has to pump against increased pressure, guess what happens? The left ventricle wall increases in size and thickness so that it can better pump because it has all this pressure. So it's like weightlifting. It's squeezing against all this pressure and the muscles actually thicker. But in the end, that can be disastrous because now that the muscle is thicker, it's going to need a better blood supply. And so the normal blood supply may not be adequate and you get problems occurring and so on and so forth. This is an example of a prostate getting larger that happens in men as they grow older. When their hormone levels change, that can happen. The prostate actual number of cells increases, but as it gets bigger, it can cause problems by squeezing the outlet of the bladder and causing them to retain urine and develop other problems like stones, infections, etc., etc. So that is a visual example. I'm showing an example here of a kidney. For example, somebody with persistent high blood pressure or persistent diabetes, it actually knocks out some of those functioning units of the kidneys that we call the nephrons. It actually knocks out some of them. They become fibrotic, they become scarred, they become smaller. And in the end, the kidney on a whole shrinks. So you may have this normal kidney with a normal size, normal weight, maybe 125 grams, you end up with one that's about 50 grams. Of course, when it reaches that size and the nephrons are knocked out by damage to the blood vessels that we get during high blood pressure, in cases of high blood pressure, kidneys are no longer able to function as it normally would have if it were the same, if it had the same number of functioning units. And so when it gets to that size, we probably are in a position of having end-stage renal failure, and the person would require dialysis. And this is real. This is not a made-up story. It's actually a picture of a real kidney. And sometimes if the kidney injury is on one side, one may be very small and the other may be normal. But if it's a problem like hypertension, which is global, which which affects the entire body, the kidneys can actually shrink in size that much. So this is a case of atrophy occurring in the kidney. No, I wasn't supposed to, how did I get there? Anyway, I had mentioned earlier about left ventricular hypertrophy. I had talked about ischemia, which is deprivation of oxygen to certain tissues. In a heart attack, for example, we have coronary arteries. We have these arteries that I have as pink lines that can become blocked by either blood clots or plaque of cholesterol, for example, that can slowly build up like how do you call it, scale in a pipe, for example, building up until it becomes too small to supply the heart muscle. And so that purple part actually shows you dying muscle. That's what happens when you have a heart attack. When one has a heart attack, muscle actually suffers from lack of oxygen. Person gets severe chest pain. That part of the heart may actually die if the blood flow is not restored within, say, within an hour. That part of the heart may actually die. And even if the person may remain alive, that heart will never function quite normally anymore. Down at a microscopic level, which is where I like to go, this is just showing what happens in a heart attack. Inflammatory cells come in and they eat up the dead tissue. Eventually what you have is what's on the right side. You have scar tissue. And so of course, if you have all this scar tissue, you can see that you don't have normally functioning heart muscle cell fibers anymore. This is a totally non-functional part of the heart. And so you can get abnormal rhythms generated from there, and that can cause problems as well. This is a microscopic example of what happens in an abscess, for example. You'll kind of see that it has a wall. The body is trying to protect everything in that abscess, all that nasty dead tissue from flowing out to the other parts of the body. It tries to keep it within a wall. But as you can probably already see, there is a lot of inflammation all around. And this is what happens, for example, in a case of pneumonia, where you have inflammation caused by bacteria in the lungs. And again, the tissue can die or it may return to normal. This is a liver, a normal, nice, smooth brown liver. You can actually, if you were to feel it, it's nice and smooth. One drinks too much alcohol, the cells become damaged and fibrous tissue develop. And they say that even a blind man can diagnose cirrhosis because the liver is bumpy and rough and nodular. That is caused by injury from alcohol. When it reaches this stage, it is not reversible. In an earlier stage, it could be reversed by just stopping from drinking alcohol. However, when it reaches the end stage, there is no return. This is an example of a brain, because the brain can also be injured by lack of oxygen, by blocking of blood vessels. And this is what a normal slice of a certain part of the brain would look like, nice gray matter and the white matter inside. However, if you have a stroke, this is actually what can happen. You can get hemorrhage in a part of the brain. This part of the brain is actually knocked out and it cannot function. So imagine if this is your speech center. After this stroke, one is no longer able to talk. So those were just examples, again, of how cells are injured, when they die, what can happen, and how the body can adapt to cellular injury. If you have any questions, sure, I'd love to answer them. Yeah, I can stop sharing. Oh, this was lung and lung cancer. Right, so that's a normal lung on the left. That's not a fresh lung. It's been fixed in formalin, but that would be a normal lung, spongy. And this is a smoker's lung, really black. And this is the cancer. Okay. Yeah, but another day we'll talk about that. Questions I shall take.
Thank you very much, Dr. Dupe, for giving us
She's
such
not-
a detailed, such a detailed description as to what happens to our body when our body goes through different types of trauma. Surely, I'm sure there are a lot of people with questions as to what certain things that they have to do to get them to that point in life. So at this time, as we prepare our questions, those of you on Zoom and on YouTube, prepare your questions as we take a short break.
Dr. Dupuy, that was very, very informative. I would really like the folk to talk a little bit. I'm going to unmute your mics. I'm sure some of you may have some questions that you want to ask Dr. Dupuy and Sherry, because the two presentations were really good. So I'm going to allow you to. I know the time is going, but I'm going to allow you. So, right, you have the ability now to unmute your mics and you can ask some questions if you so desire. Anything on trauma?
Good evening. My question is for Dr. Dupuy. Are heart attacks 100% avoidable or preventable? And is it only linked to lifestyle or can it be hereditary?
That's an
You
excellent.
gotta turn back on your camera, right? Okay.
Yes, am I spotlighted?
Yes.
And that's an excellent question, Rochelle. Yes, there are hereditary conditions that can cause heart attacks to
All right,
develop.
Sherry, stand by.
But the great majority of the cases, and you know how we like to use statistics. So yeah, the great majority of cases of heart attacks occur in the context of blocked blood vessels that are blocked by plaque that builds up, by too much fatty substances, lipids, cholesterol-related substances in the blood. Not going into too much detail, but yes, it is caused by injury to the inside of the blood vessel, and fatty substances like cholesterol are laid down there, and it eventually they thicken until they block up the coronary arteries. And I see that all the time. And that is the most common cause. Sometimes the plaque breaks and then a clot forms on the inside, because once a blood vessel is damaged internally, it tends to form a clot trying to heal itself. The clot can actually block up the blood supply, and that can cause a heart attack. But there are a few conditions that can cause sudden cardiac death that people are born with. For example, problematic heart valves, what we call hypertrophic cardiomyopathy, something that they're born with, and they tend hypertrophic cardiomyopathy. Young people who fall down and die during a football match, during a basketball match, often that is the cause. Yeah, but it's something hereditary, and you can't really change much about that.
so much, Dr. Dupree. And one last time, we ask if you have any questions, or even if you don't have a question, if you have a comment that may have been based on my presentation. I would have spoken about traumatic events ranging from a natural disaster to physical or sexual abuse or assault. And I would have spoken also about post-traumatic stress disorder, which can happen when we get stuck in a rut and we are not able to move forward. We are not resistant to the event. We're not resilient to the event. And it can also be triggered by something that may happen, something as simple as a smell, something like a sound. All of those things can be triggers for any kind of traumatic event. I would also say that in our lives as adults, and as children, we often, at some point, we at least have one traumatic event. And I see that Dr. Dupree has a question. So, sure. And I guess that question is to me.
Yes. Lurian and her husband and her mother's family, her little girl, her first girl, went through Hurricane Maria. And when they came to live in Barbados, Lurian said that anytime it started to rain, her daughter would start to cry. When can this be diagnosed as post-traumatic stress disorder? How long does it have to go on before one can make such a diagnosis? Okay, so I don't know if it still goes on.
Well, that was going to be my question.
Yeah.
To you, because if it is still going on, then yes, it would definitely be diagnosed as PTSD. But okay, in the initial stages of any traumatic event, such as a hurricane, yes, I remember, and I'm sharing this because it relates to what you just spoke about. A relative of mine, when Elsa passed to Barbados, explained to me that a few days after the hurricane, when it rained, she felt uneasy. So that was a few days. That is expected. The response can last, the normal response can last between a few days to a few months. That is normal. And a few months would be something that is repeated, something like Maria. Elsa can compare to Maria based on the volume of the damage and stuff like that. So therefore, from a few days to a few months, that is a normal time period that we expect through it, especially if it is not addressed. So I'm not sure how the parents of the child would have highlighted the issue and would have dealt with it. And there's one thing that I'm hoping that we get the opportunity to next week to speak about childhood trauma and how trauma affects children, because the way how traumatic events affect children is totally different. Trauma is subjective, especially as it relates to age. And especially because, and you would know this, because of the brain makeup of a child is different. It's not as experienced, developed as that of an adult. So whereas the parent may have also felt this uneasiness for the child, his or her response was crying. But what I would say is, if now, I guess this is about 3-4 years after Maria, 4 years, and the child still cries, it tells me that whatever was being done before was not enough, and the possibility of PTSD is very much possible.
Okay, thank you.
You're welcome.
I have a question for Sherry.
Sure.
You just mentioned children, and I was going to ask you on the children part. I found out today, by watching a news clip, that you can have long COVID. I don't know if you ever heard about it. A case of COVID, but it lasts long, for a long period. And it had this young girl. She was a teenager, I think she was, and she was like recuperating from COVID, and she has the effects mentally still. It is affecting her every day, and she has to get support from her peers and her teachers at school, those that are working with her. And she was really traumatized, and this is over I think 11 months, and she's still suffering with the trauma of COVID. So my question is, if a child gets COVID and they are well, but they are still suffering from, I don't know if it's mental or if their body is still trying to cope with getting over the disease, if you can help me on that.
You know, the thing about COVID is that it's so new, and anything that affects us physically can affect us emotionally and definitely mentally. One thing I will pull from what you said about the child that you're speaking of, she seemed to have a good family support or additional support around her. And that is important, because the body, well, in speaking of COVID, it seems like there are long-term physical effects from COVID, and there may as well be long-term mental effects. Remember, the mind and body go together. So we can't always separate and know that they are linked together. So it's very well that she is still experiencing not just the mental, but the physical as well. Yes, Doc, you want to add in here?
Well, one of the characteristics of viral diseases that can occur is that you can have chronic fatigue even after the body gets rid of a viral illness. So that may be one of them. There are physical symptoms that remain long after COVID, but I can imagine, because of all of the fear that is associated with COVID and all of the information that's going around, even if that child were not seriously ill with COVID, as most children were, the diagnosis, hearing the diagnosis of COVID is a fear-inducing factor. And there are many people who, not having the support that that child had, would probably have died, maybe not from serious COVID itself, but just from the fear of having COVID. I've had patients who have come into hospital, walked into hospital for diagnosis, and then within a few days, they knew what the results were because the biopsy results had come back. And a day after the biopsy results come back, the patient dies. And it's not from a blood clot or anything as sudden as that. It's the patient dying from the diagnosis, from getting the diagnosis. A patient that might have survived many months, therapy might have started and the patient might have survived. But just hearing that the diagnosis is cancer can kill a person. And in the same way, hearing that one has COVID, and if you're in Barbados, for example, and you've heard stories on the news about what happens here and there, one may be terrified of having that diagnosis. So survival can cause long-term mental consequences.
You know, that what you said about hearing a diagnosis and dying quickly after is so true. There are so many people, especially a diagnosis of cancer. They would have been going along for years with this disease being diagnosed, and it is diagnosed, and it just goes literally all downhill from there.
And that's why some people, they would know that they have cancer. With common sense, they would know that's that what is happening isn't normal. And some people will not turn up, because if they turn up, they will hear the diagnosis and it will confirm what was going on in their mind all the time. And they don't want to hear it because psychologically they're dealing with it better by telling themselves it's not that and it's going to get better and trying all other kinds of things, because once they hear the diagnosis, they're probably going to die.
I have a question, I think for both of you. I have a friend who was very afraid of getting COVID. She was avoiding going out because she said she doesn't want to get the virus, but she's afraid she gets it. And then 2 weeks after telling me that she knows she would like to visit me, but she's afraid, of getting exposed and what not. Her husband got diagnosed with COVID, and then a few days after she got diagnosed. And coming out of, she had to be quarantined at the quarantine facility because her daughter and son ended up getting it. And coming out of the quarantine facility a week after, she told me that she's not sleeping. She's no longer able to sleep. She just keeps thinking about it. And so Sister Sherry, I guess the question for you would be, is that a case of PTSD? And Dr. Dupuy, if it is a short-term case of trauma, would that reflect on any organs in the body?
Okay, so to quickly answer, is it PTSD? Remember, PTSD goes beyond months. From what you were saying, has she experienced her traumatic event for more than 3 or 4 months?
The fear of it, I would say.
The fear of it. So there is a possibility, yes, but I'm not going to diagnose anyone of PTSD.
Yeah.
What I say is, though, that she has some of the symptoms: not sleeping,
right,
worrying. Those things will play on your mind. There may be other things too that are going on in her life that may compound the situation. So again,
like not wanting to expose your family to the virus,
right,
or your elderly parents and all of that.
Right. So all of those fears, all of those things. So I always say, find someone that you can talk with. Find someone that is if not a professional, someone that when you talk with them, they will give you sound advice. But if you can find a mental health professional, that's great, because and nowadays with everything being online, everyone being so accessible, it's good to talk it out. When I mentioned COVID as a traumatic event, it is real, because we don't know, there are so many unknowns about COVID. And one of the unknowns is that we do not know when we will get to the other side. So for some people, that in itself is a fear. When they think of all the things that happened in the past, all the things that they used to be able to do and that they are not able to do, that in itself builds up at this overwhelming feeling.
Yes.
All of
and
those,
even not knowing what the other side is going to look like.
and what the other side looks like.
There's no such thing as normal anymore, and you can't go back to normal. So you don't know what, moving forward, what is going to happen. And I guess the fear of the unknown is a very scary thought.
Correct. Yes, Doc.
Right. Talking about the effect on the organs. Remember when we talked about stress and we talked about cortisol and adrenaline and noradrenaline and its effects on the heart, the blood vessels, blood sugar, etc. All of those can be short-term effects. She may develop hyperglycemia, which may not turn out to be diabetes, but she may end up with a high blood sugar because of the stress situation. And if that goes unchecked, she may actually end up getting the effects that diabetes would have on her organs. There's also going to be an elevated heart rate, narrowing of the blood vessels, which is what happens in noradrenaline, and she may end up having high blood pressure. But again, it depends on how long those symptoms remain, because as we mentioned when we talked about cellular injury, if the injury is mild or occurs over a short period of time, the body can adapt or it can be totally reversible. If the injury is persistent, becomes chronic, then she can end up with things like high blood pressure, diabetes. She may even end up with gastric ulcer, for example, because of hyperacidity in the stomach. If I were her doctor, I would treat her with a sleep-inducing agent and anti-anxiety drug for a short period of time for 1 or 2 weeks, let her body get back used to sleeping, let her anxiety levels go down, and see what happens. In most cases, that would work for the short term.
And if the lack of sleep or the inability to sleep lasts longer than a couple of weeks, what
I mean, if you can't sleep, that can actually kill you. I mean, that's the worst case scenario, is that can actually kill you. If the body doesn't just put you to sleep one day, you know, when you have insomnia, one day it will just say, you know what, you're going to sleep all day. It can actually be quite stressful and may require treatment, drug treatment. Otherwise, insomnia can kill. So I hope she gets some therapy.
I just would like to share my experience. After Hurricane Maria, I maybe stayed 2 weeks unable to sleep. Just couldn't sleep night nor day. And it happened one day, I just couldn't keep my eyes open, as Dr. Dupuy said. And I fell asleep and I slept the whole day until the late night, early morning of the other day. And when I really woke up, I felt so much relief. So I know what lack of sleep can really do. Thanks.
Mm-hmm.
And thank you for
fact
sharing
that
as
Hurricane
well.
Maria was at night. I suppose most people, when the night came, and you know, some people still didn't have a roof or had to be sleeping at somebody else's house. I can imagine during the night if the wind began to blow, what a terrifying experience that would be. I see a comment there.
Hi, good evening.
Good evening.
Oh, there's a comment.
I just have
Sorry.
2 questions. I need to
yes, so
make
if you
my
can
adjustment.
turn off the other device that you have
Yeah,
next to you,
I'm
then
doing that
will
now. Yeah,
okay.
I'm doing that. Yeah, good evening to everybody. Hi, Sherry. This is Denise.
Hi, good
I
evening,
just have
Denise.
2 questions. The first one is it possible to, I don't know if develop is the right term, but can you get trauma from having operations, like surgical procedures? That's one. And the other question would be for Dr. Dupuy. Dr. Dupuy, you mentioned, oh gosh, what's it called again now? Oh, it's gone from me. But
Okay, let me answer your first question.
it
while you
was the
pick up
one where you
the
said
next question.
it could go away or it can damage your cells, the scar tissue. That's it. You
Okay,
said
so
that with scar tissue, it's possible that it can stay or it can damage, it can go away or it can damage your cells or tissues. What are the circumstances under which it can actually go away? And how would you know that it has gone? I don't know if I was
answer
clear
the
on
question
those questions.
on if you can develop trauma from a surgery, any medical event that is unsettling can create a traumatic experience. But again, it depends on whether your body is able to resist or become resilient as a result of it. I'll share an example. A very good friend of mine, her son is now 14 years old. And when she was giving birth to him, she almost died. And while people usually say that when in giving birth, you are 1 foot here, 1 foot elsewhere, for her, that was traumatic. And not only for her, it was her husband. it was so traumatic that for a number of years after she had her baby, and everything went fine eventually. She had the baby, she had to have a C-section and stuff like that. Her husband was adamant that they're not having any more children based on that traumatic event. For him, it was the thought of losing his wife, and he did not physically endure it, but he was traumatized by what almost happened to her. So I believe, yes, any medical event that can be unsettling and create uncomfortable feelings can be described as a traumatic event. Yes, Doc.
Oh, relating to scar tissue, Denise, scar tissue never goes away. Scars don't go away. They can shrink, they can get bigger, but they don't ever go away. What goes away is the inflammation, as mentioned at that time. Inflammation in the lungs can completely go away. The lungs can completely resolve. Pneumonia can completely resolve. There are injuries that can occur that can completely resolve. For example, the liver will just grow more cells. So there's reversible injury, but scar tissue is irreversible. It's going to be there.
So is the scar tissue painful?
No, scar tissue isn't generally painful because it doesn't really have blood vessels or anything like that. But it can cause problems because scar tissue can, for example, you may have an injury to the inside of your elbow that may actually, because of the scar, the fibrous tissue can shrink. It may actually leave your arm in a bent position because the tissue can cause contraction of the limb. So it can cause problems, but scar tissue itself isn't painful.
Okay.
But we're talking about scar tissue on the heart. I mentioned scar tissue on the heart specifically. If there's scar tissue in the heart, that part of the heart will never function again.
Okay.
It's going to always be there, and it can cause abnormal rhythms. It can cause the heart to not function at full capacity because the muscle is supposed to be contracting all the time, and you're going to have an area of the heart that's not contracting for the rest of it.
And can that also apply to the lungs?
Yeah, you can have scar tissue on the lungs as well. There
I
are
mean the contractions.
well, you don't have you don't have contraction of the lungs per se. You do have the lungs opening and getting smaller as you inhale and exhale. So in a way, you can call it contraction. But if there's fibrous tissue in an area of the lung, that part isn't functioning as it should. So yeah, you can have that chronic lung disease caused by fibrosis in the heart, in the lung, sorry. And you're going to have a non-functional part of the lung.
Okay.
So it will never function to full capacity again.
All right, thanks.
Okay, so just as we're wrapping up, I have a comment here. Whenever I hear the news of people fleeing as refugees and having difficulties finding transportation, I reflect on the day my family and I were supposed to get on a flight to leave a country under rebel attack, but could not get on the special chartered flights provided by our country. We finally got a flight 3 months later. Is it normal to have survivor's remorse more than 2 decades later? That is something that we can answer next week. So Errol, I'm hoping that you will join us. I know Errol is one of our regulars. Join us again next week where we can discuss this further because I know Sister Sherry and Dr. Dupie have more to expand on when it comes to the topic of trauma. So for those of you who have joined us on YouTube and those of us who have joined us on Zoom, I would like to thank you for joining us. We also have a question on YouTube where a person is asking about the difference between acute stress response and PTSD. So next week, we have a lot of questions to answer. So once again, thank you for joining us. Thank you for being with us and staying with us for such a long time. And we always welcome you to invite your friends, your neighbors, and share the links that have been shared with you so that others can share in the healing moments. Good evening.
And lady.
Good night.
Take a moment for your body. Take a moment for your mind. Take a moment for your spirit. Take a moment to be loved. Take a moment to be healthy. Take a moment when you pray. Take a moment for worship. Take a moment every day. Take a moment for your body. Take a moment for your mind. Take a moment for your spirit. Take a moment to be loved. Take a moment to be happy. Take a moment when you pray. Take a moment for worship. Take a moment to show you care. Take a moment to show you care. Just to show how much you care.